Alright, so we're just going to run through a full treatment here, similar to everything I kind of went through with you guys. We're going to start with the cupping. Take a bunch of coconut oil here. So I just cover a huge area because who knows where I want the cups to go. So we'll get all up in here. So we're just going to start with the cupping to help with all the shoulder, the neck issues, and with the headaches, which my guess is stemming from all this tension, which 90% of headaches have some kind of neck and upper back correlation from tense muscles. So we'll just have her let us know if anything's too tight, too uncomfortable. Otherwise, we'll kind of do our thing. So I always throw in a few cups to start. And then I move them around and kind of palpate the muscle and see what I find. So we'll just go to it here.
Go ahead and say what you see or whatever, you know, what you're feeling.
So a big common thing with a lot of patients, and especially with her, is a muscle that's very big with neck and headaches and upper back pain is what we call the levator scapula. And this comes in and attaches to the scapula, the shoulder blade, the wing, whatever people call it, which is right here. So a lot of times I'll find a huge knot, a huge nodule, where that muscle comes in and attaches. So that's an area that I'll usually work on, especially when she says she has headaches. This is what we call the headache muscle. It's 90% of the time it's the muscle that's causing headaches from the neck and the upper back. So what I'll do is hers definitely has a huge knot in that today. And I work along the upper trap. That tends to be her problem area as well. Those two muscles start up here and work all the way up into the neck, and that's what causes that shoulder, which he talked about initially, to kind of come up into the ear. So.
Right now I'm not really that uncomfortable. It's pretty okay.
Yeah, with her we start out very light. She definitely tends to be a little bit more sensitive, and then we will up it a little bit because I do want, especially now that we've been working together, I want her to have a little bit of discomfort, very low level, you know, feel like I'm getting in there. New patient, I wouldn't necessarily do that, and she'll tell me, hey, I want this tighter, or hey, you need to back that off a little bit. So as you can see, it looks like you have this, you see some of the marks and there's a light pink feeling. So usually what happens is right after we do the cupping, it can be dark. The next day is when it becomes the darkest. So marks might actually darken within the first few hours after treatment. And then they'll lighten as the time goes on. So I'm gonna kind of stick a cup here, and what I'm gonna do is I'm gonna tighten it just a little bit at that attachment site that we talked about. Is that okay? And then what I'll do is I'll work on the right side of her back and let that cup kind of sit in the tightest area that I found for her. So this, you let me know if that's too tight for you.
My ear's just in the way.
I'm gonna do it. And then as I cup, if I see an area that looks a lot darker, when the marks are a lot darker, I'll focus in on that area because that's telling me this week that area needs a little bit more work. Because as you can see, the marks are a little bit darker on the top than they are throughout here. So that tells me that I need to work a little bit more up here because that's where more of the tension and more of where the blood circulation areas or issues are happening here.
When you're going down in the middle, I kind of feel like a little bit of move over to, yep, like around there, right there. There's something going on there for sure.
Okay. And that feedback's so important because at the end of the day, she knows where she feels more discomfort, more sensation, and that's where more tightness is, more pathology, more in need of a cup.
And I didn't feel that 100%, like other than the midline of my back is all I felt. And now it's like kind of on my right side a little bit more. So, you know, I don't know all the time what I'm feeling until she's doing that, so.
Right. Do you want me to stick some in your shoulder joints today?
Yeah.
Okay.
I don't know with the whole wrist thing too, what you want to do about that.
Okay, we might just do needles. You don't have anything into your forearm, do you?
Mm-mm.
Okay.
No.
Yeah, cups. So she talked about the wrist issue, the wrist joint specifically. Now she had forearm issues. If she had issues in her forearm, even in the elbow, cups would be great for that to help loosen up the musculature here. But for a joint issue, specifically for the wrist joint, cupping isn't necessarily the best therapy. It won't really work too well for joint issues unless it's stemming from a musculoskeletal issue, which I talked about the elbow. There's a lot of attachment sites for the muscles of the forearm onto the elbow. So if those get tight and they pull, that can cause elbow pain. Even though that's a joint, cupping excels for that. Also for her shoulder. Wrist pain, not so much, and also it's so tiny, it's a little bit difficult to even get a cup on the wrist.
Right there, also. Yep,
right in here?
Up,
okay.
Up a little bit more.
Up a little bit more.
There you go.
Okay.
You hit this.
So, and that means I'm going to keep this cup in that area that she talks about. So.
Yeah, it's kind of crazy. Because I'm like, that's weird, and feel the pain there.
Mm-hmm.
Oh boy.
So these marks, these cups are for her shoulder joints. This is the cortisone type cup, we like to call it. So for this point, this is going to be very sensitive for her because of what she has going on in her shoulders. I want this to be sensitive just when we put the cup on. So she's going to tell me when I hit the right spot. Sometimes I have to cup 2, 3, 4 times until she feels that sensation for this specific type of cupping. So
the sensation just kind of feels like a little bit of a, almost like someone's like pinching your skin a little bit. Like it's not anything crazy. Like it's not like the worst pain I've ever felt. Okay, right there. Yep. Oh boy. Yep.
You let me know if it's too strong.
Nope, it's good.
Okay.
It's like the normal one.
Good.
Oh boy. But see, whenever you get a cortisone shot, I feel like that's way more painful. Because they do, and whenever I get them done, it's like an internal one. So they're sticking a needle inside my joint. First they stick like a numbing agent in, and then that. So 2 needles in my joint. Gotta buy an ultrasound machine. So that's terrifying. And that's painful. So I'd rather deal with this than that. So yeah.
Okay. So the first time I put that cup on, she had no reaction. She was talking right through it. That tells me I'm not in the right spot. So we had to redo that one. That okay?
Yep.
Okay. Till she got that reaction. That is not usually how I cup, but for her specifically for this issue, that's how we do it. And every patient's so different. You have to adapt. You know, a lot of acupuncturists would not be familiar with that kind of technique. Works great for her. But when I cup and she has no sensitivity, it doesn't do anything for that. So that's a very specific, very different type of cupping that I don't do for most patients.
Yeah, you saw that I was in discomfort when it was on, but like I'm saying, remember Western medicine and what I need to do to get a cortisone shot to get relief, and like what that cortisone shot does to my body long term, also. Because it kind of deteriorates like the tendons or something, doesn't it?
Yes, it's deteriorating. It's so bad for your system, especially repeat cortisone shots. And what happens is the more cortisone shots you get, a lot of my patients, they'll decrease in effectiveness as you get them long term, years after years, until they stop working for, I say, a good amount of my patients. And usually the results are short lived. So. Yeah, I don't want to say cortisone shots are bad because there's some people that's all that gives them relief. And if that's all that gives you relief, if you're in need of a replacement or you can't get surgery and that's all you can do, fine. You know, cortisone, do what you got to do, especially because there are some issues with acupuncture that aren't as effective. If I can't help you, I've had a few people that needed those cortisone shots or were in need of surgery. That's okay. You know, I don't want anyone to live in any unnecessary pain. But cortisone shots and even surgery is not a guaranteed result and can actually potentially make you worse. A lot of people think surgery is the end all. I tell most of my patients you want to avoid it to the last minute, and sometimes it's great and it's miraculous. I treat quite a few people after surgery who are either the same or worse off. So there's no guaranteed result with surgery as well. So definitely keep that in mind as well. So I like to, exhaust all your options to heal naturally without these invasive things that can make you worse. And then if that's what you need as a last resort, that's what you need. I think that stuff is so necessary, but it's so often overused in our society, shots, and we go to surgery. That's why I think acupuncture and Western medicine should be used in conjunction with each other. Let's try this stuff. Did it work for you? Great. Can you live a normal life? Maybe you have 10-20% of your pain left, but you're doing pretty good. Great. If it didn't work for you, if you're still in severe pain, okay, you might be a candidate for surgery. That's when surgery, I think, is most effective, personally.
Yeah, the shoulder issue, it really blew my mind that it felt like a cortisone shot was given to me after the cups like a week and a half after her doing this cupping technique on it. So I'd much rather do this any day and put up with that discomfort than a cortisone shot. Worked for me.
And her body's way happier about that than a cortisone shot as well. Guaranteed.
Guaranteed.
You should definitely show what the marks look like in a day or two.
I will.
Because I can see this is darkening. I bet her marks will actually even become darker than they are when she leaves here.
Now, when you go down like my midline right above my scar, like, let me feel like what that feels like.
Okay. So we are right above your scar here.
Go down a little tiny bit more if you're able to. Yep.
How's that?
Yep, right there.
Okay.
I kind of feel like
So
something.
I will work on scars. I do a lot of scar work. I tend not to do it a lot because it is a very sensitive area. But there's no contraindication to work on scars. Acupuncture is great to break it up, but a lot of times it's a very sensitive area, and a lot of things can get trapped in scars. It sounds weird, but there's a lot of emotional connections with scars. So when I do scar therapy on certain people, I work on a lot of C-section scars, a lot of abdominal scars from different surgeries, with both, usually just with acupuncture actually, and the results aren't crazy because what we're doing is we're breaking up that scar tissue, which can help with a lot of different things, especially with abdominal acupuncture. All your systems, your digestive system, your gynecological system, can get affected by just a superficial scar. I had one patient come in with, I think she had a C-section scar and a appendix scar, and we worked on breaking them up. She had a lot of menstruation issues, a lot of digestive issues, and she actually was not able to lose weight in half of her abdomen. It was actually this lopsided effect. So we worked on breaking up that scar tissue, and she actually had a lot of emotional releases on the table where she had a very traumatic birth with her last child, and that's where that scar came in, and she felt a lot of those emotions kind of uncontrollably that were kind of stuck in that scar. Sounds crazy from a Western perspective, but it happens all the time. We got her where her periods were abnormal, not painful, totally great. Her digestive system cleared out completely, and she was able to, I think about 70-80% lose that weight in that, I can't remember what side of the abdomen, but her abdomen evened out about 70-80%, which to me was a very good thing because that's a very specific thing. I told her straight up, I'm not even sure if I can help you with the weight thing. So
crazy.
yeah, so scar work is definitely depending on the sensitivity. If I can't touch your scar without sensitivity, I will not go near it with a needle. A lot of scars tend to be dead. You can touch it, people have loss of sensation in the scars. But scars anywhere in your body can affect any system. Even if it's not on your abdomen, it can affect your digestive system, it can affect pain, because blood isn't moving through there. There's all this scar tissue, there's a blockage, and that can cause a lot of disharmony. So, just when we're on the topic of scars. So this is actually, for her, when I first started cupping her, this would actually look very mild compared to when I first started cupping her. Let's see if we can show. So let's look at this mark. See how dark that mark is compared to, say, this mark? That is that cortisone shoulder joint type mark. Now that one and this one will actually probably, in my gut feeling, darken here a little bit. But that's like a reddish purplish type cupping mark. That means there's more impairment of blood flow in that area than, say, this area at this moment. So yeah, and what I'll do is I'll slide them around different areas, keep them in areas of less.
Up here, there's a weird feeling, there you go.
So what we'll do is, she's talking about the contour of her neck, so we'll actually get a smaller cup that won't pop out as easily as that one does. So I find it so important to get the patient's feedback, because a lot of patients will come in and say, this hurts, this part of my back hurts, but I'll cup and this is where they're most sensitive, because really their issue, yeah, their upper trapezius might be tight, but their issue might be coming from this isn't a great example, but might be coming from a different part of their back. So if we relieve the tension here, that helps relieve the tension in a different area. So that's so important as to why you know, where the patient feels that discomfort, feels some kind of sensation. Am I in the general area?
Yeah, it was like a.
Okay, I'm gonna move through it a few times and then I'll leave you with a little friend.
A little friend.
Yeah.
Yeah.
Oh yeah, you got a good. Ooh.
Yeah.
I don't think we worked too much up here for you.
No.
Big mistake.
Yeah, like I was like, ooh, that feels different, and I was like, oh.
You have instant, so she has instant color coming up on here. I'll see if we can get it on camera. If not, yeah, instant stuff.
I wonder if it's on the other side too.
Yeah, we're gonna do the other side, absolutely.
That's oh my god, that's crazy.
You doing okay?
Yeah.
This is so the upper cervical neck tends to be a little bit more sensitive because you don't have as much flesh here, and yeah, this is one of my favorite. This tends to be very sensitive for a lot of people. But so good, and we'll show you.
The fact that I can sit through this now is crazy because
Yes.
I had a hard time at first.
Some oil here.
It was definitely crazy at first. That's how like much acupuncture and cupping has taken down my nervous system from being so on edge at all the time.
Yeah, it'd be great to have a comparison from day one, just from
know.
that needles, not even from the cupping, which the cupping's a lot more sensitive than the needles.
Yeah, like I wish if we would have thought about it.
It would have been.
I think I have some like vlog footage of me like saying what I have, you know, noticed and stuff of acupuncture's done during my first couple of treatments. So
Yeah, you have stuff coming up on the side. Definitely
Yeah.
not as much as
it's kind of coming like here.
more laterally.
Yeah, I wonder if like try that. Cause I kind of feel like you were like here and then it kind of.
I was kind of on the edge of that.
Yeah. See what happens if you go that way with it. It's my hair.
No, it's just tough because it's the curvature of your neck, so it's gonna be really hard to get a
I'm
cut.
trying.
Oh, you can't do anything. You're
I was
doing
gonna
great.
say, do I need to like stretch?
No, it's just such an awkward angle. Yeah, let me see. We'll start here, see if we can work our way up. So we're working on the curve of her neck, so it's a little difficult because that's where to get a cup to stick to a curve is a little bit more difficult. That's why I say you can cup any area you can get a cup to stick to.
Oh yeah, right. Yep. Mhm. Oh boy. Yep.
You tell me if it's too much.
No, it's fine. It's just definitely we hit something there. It's like mining for gold.
It is. It is. Your neck is gonna look so good. It's so scary after this.
So good, but so scary. Oh boy, yeah, like right when you're coming, yeah, oh, yep, oh boy.
So we never actually did this type of upper trap cupping, which makes me so upset because I do this on quite a few people. The reason why I probably didn't start with this with you is it's very, very sensitive on even my least sensitive patients. And when I say sensitive, I just mean you can feel it more. It's like it's still usually for most patients like a deep massage hurt, but for the most part, it's not painful. It should never be excruciating painful. If you're jumping out of the seat, it's too sensitive. Now, for what she has going on, but you know, usually it's not.
Yeah, definitely. I'm feeling this more than the other ones because we
Yes.
found something that's like obviously upset in my body. So.
And we know that's a good thing.
Yeah.
Sensitive means more results, means feeling better.
Yeah, that's why I'm like telling her like you tell them because if you don't tell your acupuncturist, then you're not going to get the relief. So
Yes.
just deal with the little moments of discomfort and be like, yeah, that's the spot, and then you'll get something from it.
Yeah. Let's show this camera what we just did here.
Mm-hmm.
It is absolutely. So I get so excited when I see marks like this because it shows me this treatment's going to do so much for her and she needed this so much more. So let's see. I'm going to hold this here. So we'll start here. So see all that red? It kind of looks, I always describe it, this is what like petechiae, we call petechiae little broken blood vessels. Because we are in a way inducing a little bit of trauma to the muscle so that your body pays attention to it, sends its nutrients to that muscle and heals it. Because a lot of times with chronic pain is you have pain for so long, your body will actually start to ignore it. It won't take it as a threat. It won't try to heal the area. It'll say, okay, this is our new norm. We're gonna kind of get into the rhythm of it. And we want the body, we kind of want to shock the body into saying, hey, her neck and shoulders aren't okay. There's an issue here. Send your red blood cells, send your white blood cells, take care of it, try to loosen it up. So that's why, in a way, we are kind of creating a little bit of inflammation, because inflammation these days is such a bad term, such a taboo. Oh, you know, you have a lot of inflammation, which is true. But when you hurt an area of your body and you want to heal it, your body will create inflammation. It will create all those, you know, send the white blood cells, the red blood cells to heal the area. Where inflammation is bad is when it doesn't go away, it becomes chronic, and it's no longer a benefit to the area of the body. So in a way, creating a little bit of inflammation so your body will start to pay attention and heal is beneficial. I always tell people after cupping, drink a lot of water, because we are releasing a lot of lactic acid into the system, like we talked about with that soreness thing. So we want you to basically flush out all those toxins, all that crap, for lack of a better word.
I actually kind of feel like a little bit tired too.
Because that stuff's being flowed into her system as we speak. Her body has to break that down and get rid of it. Better out than in, but you can feel the effects of that while it's in your system until you literally pee it out, for the most part, is what most people, some people will even sweat it out. That's a little bit dramatic, but it is kind of, in a way, a little bit of a detox process. We're just gonna put a bunch of needles in. So we're working on local musculature with her, and we're also working on a central nervous system treatment for her on the back. So she'll let me know. Like I said, she might feel a quick pinch when they go in. If she has any discomfort after that, sometimes you'll get a diffuse achy sensation. As long as it's not too much, that's actually a very positive thing with acupuncture. With this type of treatment, you're not supposed to, you usually don't get a lot of that. She will get that occasionally, but for the most part, you don't. Other treatments, you will feel that a little stronger. As long as you can still relax, it's beneficial. If it's too strong, too uncomfortable, or if you have any other sensation, I want her to tell me. I just have to adjust the needle a little bit, and she should be fine. Yeah, so for most of this central nervous system treatment, these needles, we just tap them in. We don't ever put them in a little deeper. For the muscles, I'll put them in slightly deeper. And by slightly deeper, I'm talking millimeters here. What I'm doing here is we're looking for very specific acupuncture points, at least for this first part of the treatment. So what I do is I count vertebrae on the spine to find a specific level, and that tells me where I need to put the needle. Now, we're not putting needles in the spine. Some people will do that, and that's totally okay for certain issues. For this type of treatment, we're just finding the area of the spine, and then we work our way out a very specific measurement, and that's where the acupuncture point is. So that's me palpating, is kind of locating these different acupuncture points.
That one stung a little bit, but it wasn't like, oh my gosh, you know.
And if there's a really tight muscle, if there's a blood vessel nearby, she will feel potentially a little bit of a sting, maybe a little bit of a pinch, maybe even a little bit of, trying to think of another sensation. Any one of those sensations, it's usually when it goes in, and then it disperses pretty quickly. And then if it doesn't, that's something I want her to let me know, because that means I just have to adjust the needle. But with all the anatomy, occasionally you will feel a little bit more at a certain needle. And certain patients, I've had some patients who barely ever feel any needles, no matter where they are, even if they're in more sensitive areas. And I have some patients that will feel almost every needle. And when I say feel, it might be a quick pinch, or they might just be aware of it. So everyone's different, but I've never had a patient have an issue with the needles with treatment. So usually it's more of a mental thing. It's more of that, you know, there's needles in me right now. I have had 2 people that were very anxious about just having needles in them. Other than that, I've never had an issue. I treat children. My youngest patient at the moment is, I think, 5, maybe 6. Acupuncture for kids. Kids respond so much better than adults, so much faster. I did a pediatric rotation up in Boston where I treated newborns, mostly those addicted to drugs. And Sometimes we'll use needles, a lot of times we do pressure, and they did great. So I treat children. Sometimes we'll use needles if we can work into it. Sometimes we won't even need needles. It depends on the comfort of the child and the family and how they're doing with or without needles. And then I treat, I think my oldest patient right now is 96, something like that. So I'll treat all ages. There's no, limit to who I can treat. So we're gonna try with these normal needles on her wrist. Usually wrists, hands, arms are a little bit more sensitive than the back because there's more nerves, more concentration of nerves. So we'll do this. I do have slightly thinner needles. If she is a little sensitive to this, we will just use those. I have in the past, but we'll see how she does.
Yeah, that was fun.
All right, any of those bothering you?
No, none at all.
Okay. Another branch of acupuncture is auricular or ear acupuncture. So very, very effective. You can treat everything in the ear. So the whole body is imaged on the ear. It's if you image a fetus and then you flip it, so the head of the fetus is in the lobe and the feet are kind of toward the top. So you can treat any organ system. You can treat pain if you have pain in your head, your feet, your spine, or you can treat internal systems, digestive system, gynecological system, based on where it falls in the fetus and where it falls in the ear. So what we're gonna do, we do a very specific protocol here. It's called battlefield acupuncture. I've never even actually told you this.
Yeah, I'm like, wait, what?
So this is the set of 5 points we needle for her. It's my favorite point for any kind of chronic pain, stubborn pain, severe pain. They actually use this in soldiers before, so whenever there was an injury, they would put this protocol in before they could get the soldier in for treatment. It would help kind of minimize the pain until they could seek treatment. So that's why it's very effective on the battlefield. That's why it's called battlefield acupuncture. So we're gonna throw these points in for her.
That's interesting.
So I use, these are, you can see here, they're kind of light green. These are slightly thinner because the ear has basically no flesh on it. It's a little bit more sensitive. So I like to use thinner needles. I like to be nice to my patient.
Yeah, that's, every time I'm like, oh geez, but it's nothing.
Yeah, and these don't go in deep because there's really not much to go into here.
Yeah, these ones will randomly, if I move, will fall out.
Yeah, they do tend to fall out, especially if usually patients are laying down. Since we're working against gravity, sometimes these can pop themselves out.
And then all I do is let her know and she'll put it back in.
Yep. That's it. That's 5 needles for that protocol that we throw in there. And then what we do for her is we actually put in ear seeds after the fact, and we can show you them
When
we're done. And that kind of is a take-home treatment, so that will constantly, very similar to acupressure, constantly stimulate that point so that the effects last for a few days and it's not just while you're in for treatment. And I find that very effective for a lot of people, and especially for tougher cases where they can't make it in as frequently and you want the effects to last a little bit longer for the patient. And they're basically little, just tiny metal balls that on stickers you put on specific points for the patient. Needles usually typically stay in anywhere from about 30 minutes to 40 minutes. Sometimes I'll do 2 sets of needles, in the front and then one on the back, depends on what I'm treating. Usually I stick to 1 set of needles because I think it's so important for the patient to lay there and relax for, a good 30 to 40 minutes. They did MRI studies, I think, this might be incorrect, but approximately the body responds to acupuncture needles for about 28 minutes. It was a very specific time before it starts to ignore them. That was an MRI study that was done. So they like to say you should keep the needles in minimum for about 30 minutes for the body to have the full effect. Sometimes I will leave people in for longer because I find just being able to relax in silence is so therapeutic for most people's issues, and to get into that deep state of relaxation that a lot of people get into is almost just as therapeutic as the actual needles. A lot of my patients will fall asleep during treatment, and then a lot of people will just feel super relaxed during treatment. So we turn the lights off, we let you relax, we either put on some music, don't put on some music, and you kind of mellow out and just kind of relax and let the needles do their thing. So a lot of the athletes I treat are very orthopedically type patients. So they'll be on their phones, or I treat a lot of them in their homes. They'll be doing other stuff. You can do other stuff during treatment. If you're getting treated for anxiety, insomnia, stress, I will definitely not let you have your phone with you. I don't let most of my patients have their phones with them, or let them read a magazine, especially if you're being treated for something like this, because I think that is, you know, such a impact on your issue. But I do treat a lot of athletes who like to be doing other stuff because we're releasing muscles. It's a very local treatment, a very orthopedic type treatment. Well, yeah, they can definitely relax, but most people have difficulty relaxing. But in my clinic, most people, lights go off and they take a quick 30-minute nap, and it's usually, a lot of my patients tell me it's their favorite part of the week or the month or whenever they come in, because they're able to fully relax. And most people don't get that relaxation time. Relaxation for a lot of us is watching TV, being on our phones, you know, doing some kind of stimulation. To be kind of forced into laying still and relaxing for 30 minutes, for some people is very difficult in the beginning, but is so rewarding and so amazing. A lot of people will feel like they got a massage, you know, that feeling after a massage where you feel kind of out of it, similar to what we talked about before, super relaxed. My patients will walk out feeling that way. So it's so powerful, and that's approximately how long I need to leave the needles. And if I'm doing a two-sided treatment, sometimes I'll do 20 to 25 minutes, and then I'll switch to needles, and then we'll do cupping. Usually I do cupping, depends. Sometimes I'll do it in the beginning of the treatment, sometimes I'll do it at the end. It just depends on a lot of things. A lot of time it's just based on timing, based on what I find best for the patient.
Another thing that I've been asked by a fellow spinal cord injury person is, you know, like, below your injury level, like say you're a complete injury, or, you know, there's no nerve route, if you will, like getting back to your brain to respond to much. So if she puts needles below my injury level, do I respond to it? We tried it before for a treatment, and I personally didn't really like notice as much as like where above my injury level. But she has more information about that. So.
Yeah, for the most part, if there is, it depends on the type of damage that's done. I have had one patient who did great with needling in the legs. For the most part, you don't respond to that if there is an injury to the spinal cord at a certain level. But that kind of brings me off to a new topic, and we will experiment. A lot of times I will do a lot of needles in the legs for upper back, neck issues. They're very powerful needles, and that's what we tried with her. Didn't work so great. For my next patient, it worked wonderfully, where maybe they wouldn't do great with the needles in the back. So that's why we have to, in a way, kind of experiment and see how you respond. Most of my patients will respond to the therapy I kind of start them with, but we do have a bunch of different tools. Say, you know, I've had some patients, I have my 96-year-old patient, she barely can get in the chair. She had severe low back sciatica pain in her glute. There was no way I was going to get into her glute, which is sometimes how I treat sciatic pain. So for her, I needled her arm, got rid of it in 2 treatments. Whereas her last acupuncturist did great, got rid of her pain. She actually had to stand up against the wall because he was sticking them in her low back and glute, which, you know, isn't ideal. So, you know, we have to be adaptable, we have to be variable. But that brings me to another point, phantom limb pain. So people that have had amputations, a lot of times will have pain in that limb, even though it is now no longer a part of them. And there's a lot of different therapies that they do. You know, they'll put a mirror in between the legs so the person can visualize both limbs. Very powerful, I don't know the name of it, very powerful, very effective therapy. With acupuncture, what we do is we'll needle the leg or arm or whatever it is in the exact same areas where they're feeling the pain in the missing limb. And what we also do is sometimes I had one patient that worked a little bit, didn't give us the results we really wanted. So we took a towel and we rolled it up and put it, I think it was his left leg, one of his legs, I think it was his left leg. Put it where the limb was, and we needled into the towel, and he could feel sensations in his phantom limb as we worked on it. And that was what really did such powerful things for him, because those points, those acupuncture points, those meridians are still there, even if the limb is not.
Wow, that's crazy.
Yeah, it's a very powerful, very not a very well-known thing to people outside in the acupuncture world. I think most people know of it as a therapy. Usually we'll needle the opposite limb in the same places, and we can do that even if you you know, don't have a missing limb. We can needle the opposite side. It does wonders, you know, especially if you're post-surgery and your entire leg is in a cast. We can't needle into it, so we'll needle the opposite leg. At the end of the day, your body doesn't know it is, you know, 2 arms and 2 legs and a torso. So if I were, you know, if Barb says my left arm hurts and I put needles into her right arm, Barb's body's not gonna be like, oh my gosh, what are you doing? It's my left elbow, not my right elbow. Your body is just a bunch of neural connections that connect up into the brain. And someone a long time ago figured out that your left elbow and your right elbow connect in the same area of your brain. So your body doesn't know the difference between I'm sticking a needle here in my left elbow or my right elbow. That's a hypothetical. But yeah, your body doesn't know the difference. And I have had very effective treatments because not only sometimes I don't want to go near the area of injury, and sometimes that didn't work great for the patient. So I do what we call distal or away from. Very effective, very quick. It's just another way of healing. A lot of times I'll add both modalities into my practice, but they're both very powerful and very legitimate ways to heal. So there's a lot of different styles of acupuncture. You go to different acupuncturists, you usually won't get the same experience. One's not necessarily better than the other. It's a very personal decision, and that's why people like their acupuncturist. I've had people that have come to me from other acupuncturists that preferred my type of treatment. I've had people come from other acupuncturists that prefer their other acupuncturists. So acupuncture, for the most part, it's generally the same, but there are some variations. So you have to find the right practitioner. If I didn't do well for a patient, I will never say acupuncture can't help you. I will refer you to another acupuncturist. Because I said I've had people that the shoulder pain case I talked about, he went to 3 other acupuncturists. For whatever reason, my style of therapy, I didn't touch his shoulder at all. I worked on his ankles. Worked great for him. So if an acupuncturist isn't working for you, I strongly advise at least trying one other practitioner, because you can get a whole different result. Just like chiropractors, just like any kind of occupation, no 2 practitioners are equal.
Even
or
Western
the same.
medicine, they always say get second and third opinion.
Yeah, that's not just limited to that. So definitely, you know, don't rule out acupuncture just from one practitioner.
I had someone ask me this before: Chinese, Asian acupuncturists compared to American acupuncturists. Like, I've heard people say you want to see an Asian one because they're better, more legit. Do you believe that that's true, or what do you think about that?
I think that's a loaded question. For the most part, no. I don't think necessarily Asian practitioners are better. A lot of times Asian practitioners are doctors in China, and then they'll come over here and treat. So they do have a bigger scope if they did get their acupuncture training in China. I'm not talking about doctors that get that 300 hours training. Asian practitioners are wonderful. They're great. Certain patients, it depends on, in America, we practice very differently than they do in China. So some patients really resonate with how an Asian practitioner treats. They tend to be, and this is a big generalization, it's probably not 100% across the board, but in my experience, it's common. They tend to be a little bit more aggressive with their needling. In China, that achy sensation we talked about, see, we already lost one here.
Yep.
That achy sensation we talked about, we call that, that's Petechiae, okay? So that's a sensation that in China, they want to get with almost every needle. So in China, treatments can be very intense. I've gotten treatments from Asian practitioners before. Now in America, if I were to do that type of treatment, I have some patients that resonate with it. Barb, you would never come back to me if I did that type of treatment on you. Okay. It can be very intense. It can be, I don't want to say it's painful, because if you know the sensation, it's not painful, it's therapeutic. But a lot of times if you feel an achiness, that's pain to a lot of people. So a lot of Americans won't resonate with that. So we can't really treat the way we treat in China. So I think a lot of Asian practitioners, they have adapted for coming here, but they do tend to be a little bit more aggressive. But they're great. They're great practitioners. At the end of the day, I personally don't believe one's better than the other. As long as you've had that training, that 3 to 4 years, I'm not sure what it is in China. As long as you've had that training, I think it depends on the style you want. If you want Chinese, there's Chinese needling. It's more aggressive, it's deeper. That's great for certain people. There's Japanese acupuncture, which is actually, there's not a ton of Japanese practitioners around here. That's better for kids, or if you're very needle sensitive and you don't like a lot of stimulation. For Barb would do very well with Japanese acupuncture. The needles are a lot thinner, they barely go in. So that's just food for thought. But I personally don't think one's better than the other. A lot of people think Asian practitioners are superior. If if you studied in China for 30 years, yeah, you probably are a great acupuncturist compared to, you know, an American practitioner who hasn't had that type of training. But honestly, acupuncture is so great across the board. I don't think there's a huge discrepancy. If you want a more aggressive style of needling, an Asian practitioner may be better set. But you can tell your practitioner. I do some of my treatments look very different. This is a very gentle, a very shallow needle technique. On my Steeler that I treat twice a week, I'm a lot more aggressive with my needles, and he likes that. If I did this type of needling on him, he probably wouldn't feel much of a difference. He's working and he has, you know, different issues, but that wouldn't work great for him. So when he was looking for practitioners, I think he called and he asked, do you do aggressive, you know, orthopedic type acupuncture? So it's more about the style, I think, than necessarily the practitioner.
Okay. How about that? Now the one while she was talking, the one in my ear did come out. So I handed it to her, and she opened a new one and is just replacing it because it's just that shallow. Like it's not deep. How about like saying about this story about the Asian practitioners who are visually impaired?
Yeah. So
that was cool.
Yeah. So in China, some of the best acupuncturists, to be honest, I don't know if this is still a recurrent thing. In China, I'm going to go off on a few tangents here. Acupuncture are in a lot of hospitals in China. It's like a regular part of mainstream medicine, where it's not so much here. Here it's alternative medicine. But in China, acupuncture, I have patients come in once or twice a week in the beginning. In China, you come in every day for 1 or 2 weeks, and that's your plan of treatment. Acupuncture is best done close together. It's like taking a pill. If you got prescribed a week or 2 weeks of antibiotics and you took 2 pills and you said, I'm done, and you went to the doctor and said, why didn't it work? Your doctor will look at you and say, you have to finish the protocol. 1 or 2 pills is not going to do anything. Just like 1 or 2 treatments, you might start to see relief, but the real magic comes when you stick with a plan of treatment. Closer together is better, but in America, you know, with money, with insurance, with people's schedules, it's not as doable. But that's how traditionally acupuncture was done, every day. Sometimes for really severe issues, twice a day. So that's why I try to get people in the beginning to gain momentum as much as possible. A lot of people will see your chiropractor, I think, 2 to 3 times a week in the beginning. Acupuncture is very similar to that. But that's not at all what you asked me.
Yeah.
Oh, you asked me about, okay. Yeah, so the best acupuncturists in China were visually impaired. Because you don't have vision, all your other senses are heightened. So in acupuncture, what's very important is palpation skills, the touch. When you can feel the different muscles, you can actually feel the acupuncture points. So these practitioners had such a high and such a sensitive palpation skill that they tended to be the best practitioners because they didn't rely on their vision, which actually in school we were taught to close our eyes as we palpated for points, because you rely on your eyes too much and you think you see things that aren't even there or aren't even accurate. So if you close your eyes and you palpate, your fingers can feel more than if you don't. So that's just something that we were taught in school here.
I thought that was pretty cool.
Yeah, it's very cool. I don't know, to be honest, in China, a lot of acupuncturists are from, this is way back in the day, I'm not sure if it's the same now, we're from family lines. So if your father was an acupuncturist, you'd be an acupuncturist, your child would be an acupuncturist, and you would kind of mentor. There was no real formal schooling now. I think now there's formal schooling. It's kind of like medical school over there. It's a lot more intense, it's a lot more strict and more difficult than in America. I'm not sure if the Western, if you have to become a medical doctor to be an acupuncturist in China, that I'm not sure. You might have to, but it's a little bit different than, you know, in America. They have separate acupuncture schools. I think there's about 50, maybe 100 acupuncture schools in the country. That's a wild guess. They're not super numerous, but there are separate programs from any other type of degree.
So now she's taking them out. She already took some out.
I already took some out.
It's fine.
So what I do is I have a little Q-tip here, just in case we get a few drops of blood. We just want to wipe them up, and then what I'll do is I'll just take them out. Super.
And it doesn't hurt when they come out. I mean, you feel it coming out, but it's not painful for me.
Yeah, usually taking out, I don't think I've ever had a patient report them being painful. Sometimes you will feel them coming out, but that's pretty much it. And then I go over and make sure we don't have anything ordinary here.
Here's my wrist.
Oh, I forgot to touch my wrist. See, we had tiny drop of blood there. Wipe away.
Yep.
No big deal. And then we'll do your ear. Ear tends to bleed. Oh, and we just dropped one.
Yeah, one fell. I'll get it once we're done taking them all out there. Alright, hold on. It fell in my booth, so hold on. There we go. See, this, since it was in my body, I'll show you guys, like I'm like sitting here like going hard on this, and it's like the needle is bending. Like it's not, like I said, it's like a filament. It's not like, it's crazy to me that it's like known as a needle. So I'm like,
and I'm sanitizing my hands between all these processes. I'm not really showing it.
Yeah, she has like Germ-X Advanced that she like is constantly using.
Yeah, and when I leave the room, I wash my hands. I don't have a sink in the room, but I sterilize before I put the needles in, after, before I do the cupping, after. I basically constantly do it. So just in case anyone was wondering that. The take-home treatment we talked about for her ear, we're gonna do those 5 points in her ear. And basically, we're just gonna swab that. Okay. So I have 2 different types of, we call them, there's either press balls or ear seeds. And they're basically, we'll show you a little thing here. That's a little tiny stainless steel ball, okay? And then it's on, a sticker's on top of it. So basically, we put that on the point, and then that constantly stimulates the point. And even I'll have some patients take their thumb or finger and even massage the point sometimes if they feel like they need to. Some people do, some people feel like they do the work themselves. So that's what we call a press ball here. And then we have these little seeds. They do the same exact thing. Some patients prefer the seeds, some patients prefer the press balls. So here's a sheet of ear seeds. There's the stickers, and if you turn it over, all those little black dots are all the ear seeds. So very similar to the press balls you can talk about.
And then the press balls, like, to me, they were like really small and like they're more discreet and you can't really see them as much, but like whenever I'm getting sugar craving something, when I push on them, I'm like, am I really pushing on it? So I prefer those, and the only thing like I get are people like, did you cut your ear? And I was like, no, it's like
because it looks like a band-aid. I have had 2 other patients say that. Most of my patients prefer the press balls. I do have a few people that like the press or the ear seeds. Same idea, whatever you prefer, you know, it's a very, to me, a very...
Do most acupuncturists have those on hand usually?
I think most people, to be honest, most people use the press balls as far as I know. I personally, they were out of stock. I couldn't get the press balls, so I ordered the ear seeds. I don't like them as much because I don't feel like they stick as well. But I'm glad I have both now because I have had a few people that prefer the ear seeds. So usually I give...
They're just bigger and easier to push, I think. They usually last for me like maybe 5 days tops, so...
Yeah.
The press balls last a little longer though, but I don't feel like I'm getting as much, if that makes sense.
Absolutely. All right, so we're just gonna stick a bunch in her ear here. So this might not even be sticky because we've been playing. Oh no, it's good. And then I kind of give it a massage, make sure it's in there. And that's it. Nothing too exciting.
Just the last final step to be sent home until I'm like, okay, for a couple days afterwards.
And I always tell people with these, if you have any issues with them, take them out. You know, sometimes they'll be a little itchy or they might be a little uncomfortable.
If she puts them on like the outside of like the rim of my ear, if I sleep on that side, I will wake up and it is kind of achy. So I will take them off if like it's starting to feel a little bit achy. But it's nothing like crazy.
Yeah.
Like I have so many piercings in my ears that I'm like used to achy feelings in ears though, so.
Yeah, most people will just forget they're there unless someone brings it up.
Yeah, I don't remember that they're there usually, so.
They do have some funky ones that are actually like crystals that a lot of my younger patients will like especially the girls. It looks like they have some extra funky ear piercings. You can get very creative with these, but all you need is some kind of stimulation, even if it's just your finger. It's all doing similar stuff here.
Interesting. Who would have thought the ear did so much?
Mm-hmm.
Now, I asked you that, like, because I have so many piercings in my ear, does that affect any of the pressure areas or the acupuncture points or anything?
So, yeah. So, ear piercings is such a controversial topic for most acupuncturists. It's up for debate. So there's different theories. For the most part, some people believe that if you pierce acupuncture point, the point will actually just move a little bit to the side. Some people think that if you pierce an acupuncture point, it'll deaden the point, it'll stimulate the point, and then the point will be overstimulated and it'll kind of start to ignore the signals and kind of deaden, which can be bad. I think I've only seen negative repercussions on the belly button, because you do have an acupuncture point in your belly button. We don't needle that because it is your belly button. But I've had a lot of women who've had very painful periods, infertility, digestive issues, who have a belly button piercing. I tell them to take the belly button piercing out, because that is a meridian that runs right through there. A lot of their issues will actually get a lot better just with having that piercing out. That's the only time I've ever seen it become a real issue. But for the ear, for the most part, some people will get that tragus piercing for migraines. It's a very popular thing. There's a lot of different ear acupuncture points, theories. So like there's German auricular, there's Chinese, there's French, there's American, where the points will vary between all the different ones. I've only learned German, American, and I think Chinese were the three that I learned. That tragus point, that point in the ear for migraines, for all the styles I've learned, does not correlate at all with the head, with migraines, with neck, with anything that would help migraines. So personally, I don't see why it would help, but I have had a few people that it has helped with. So there could be another theory as to that I'm not familiar with. Personally, I would not advise piercing a point in the ear for symptomatic relief, because what happens a lot of times, it's just temporary. Like I said, it might liven the point, and then as it deadens, it'll go away. Sometimes it can make the pain worse, which, to be honest, I'm not sure why. I think sometimes when you needle a point, there is a possibility of things getting worse temporarily, whether that's beneficial or not. We learned we don't needle that point. But I have had a few people that said that it exacerbated their issues. And for the most part, at the end of the day, a lot of the points are around the cartilage. Now, cartilage piercings can be, you probably can speak to this better than me, but they can be somewhat difficult to heal. So know that you are piercing an area of the ear that will take some time to heal, can be sensitive. That's why I think you should think twice. Now, if you are at your last resort, nothing's helped you, why not? I would get a tragus piercing if I had severe migraines and I did everything.
I mean, look how cool mine looks.
Yeah, like if you want it for style, I wouldn't worry. I personally, some acupuncturists won't pierce. I have no repercussions for piercing those points in my ears if I want to look really cool like Barb here. I personally wouldn't do it for symptomatic. I would just stick needles in there, I would stick press balls in there, and then I would give it a break, because at the end of the day, you don't want constant stimulation on one point. Your body will start to ignore that signal, just like a piercing. So at the end of the day, you know, like I said, if you're at your last resort, I've told people that if you are familiar with cartilage piercings, how the healing process will go, and you want to give it a shot, worst case, you can take it out. But that's something that you have to be aware of, in my opinion.
And it's not like hurting me. It's not affecting the, you know, like the points at all. Like it's not.
No, I believe anything. My own personal belief is I don't know whether the point moves or it kind of starts to ignore the signal. I don't think it has any long-term negative effects to the points. I do think temporarily, whether it's beneficial or not beneficial, it does have an effect on the point. That's why some people will feel worse initially or feel better initially, because it is stimulating the point. Long term, I think the point will move, or your body will start to ignore the signal. So I think it's pretty much, you know, harmless for long term. That's my own personal belief. It's a very controversial topic amongst acupuncturists as to this point, and just needling or piercing in general. But I personally don't think it's effective to pierce. I've gotten that question not only for headaches, but for allergies. There's a point in the ear for allergies that's really good. I've had a few people ask me whether they want to pierce it, and one of my patients wanted to pierce that area anyway, and she wanted to know if it would negatively affect her allergies. I never am 100% sure, but I said most likely I don't think it'll have any issue with your allergies.
Interesting.
And like I said, worst case, you just take it out. It will, you know,
it'll
no
heal.
Big deal. It'll heal. So
yeah, it's not like it's a permanent thing. But yeah, so she got all the seeds in my ears, and that's kind of what it looks like.
So here's some of the aftermath. Move your hair so we can see this beautiful neck stuff. So we'll show you. So see how that's her cortisone. I'm going to call her a cortisone cup here. You can see some fake cups here where we didn't get as much. Some darker cups. This is where she was pointing to before, and here's right above her scar. And we got over here. This other mark here is right underneath her tattoo. So you can cup with tattoos. The only time I would not cup with a tattoo if it's super fresh, because you can actually pull that ink out. So a fresh tattoo I would not go anywhere near. Old tattoos, absolutely no problem at all, but we can't see that mark because it's right underneath her tattoo here. And then here's the neck where we did the sliding cups up into the neck here. So this is beautiful stuff. This means she absolutely 100% needed the cupping, and she'll start to notice the benefit within a day or two, or immediately. It really depends on the patient.
Yeah, right now I'm currently feeling like an achy feeling, which she did describe can happen after cupping. It just feels like an achy joint feeling, and that's a really good feeling to have. What did you call it?
Oh, the Petechiae sensation? Yeah, that's a great sensation, as long as some people are wary of it, because achy is a type of pain.
Yeah.
It's very therapeutic, a very good part of acupuncture.
Yeah, it is kind of weird. Like when I first felt it, I'm like, I feel like it's hurting, you know, but the next day I felt like $1 million. So, you know, it's just part of the treatment. It's not anything like that's like, oh, I can't deal with it. You know what I mean? Like, again, Western medicine does way worse to me. So that was an informational guide. That was a treatment, and that was a review of all of the items that are used when you get acupuncture, and the benefits and possible side effects and the education behind it all, and just knowing, because you have a disability or any kind of issue that you may feel hopeless about, or that there's no hope for it, just know that this is an option. This is an alternative option that a lot of people just overlook here in America. I don't know why. I mean, I was one of those people. I was like, oh, this is so hokey, it's never gonna happen. You know what I mean? Because you just get to this point of feeling so hopeless, like nothing's gonna help, and why would a bunch of needles randomly put into your skin help? Like, that's crazy, you know? So I get exactly why people feel the way they do and are skeptical. I get it completely. But I am one of those people, like, I'm telling you the truth, it definitely has helped me. It's changed. It's given me a better quality of life. It's made me be able to do my job as Miss Wheelchair Pennsylvania to the full extent that I could. I would have, if I was still frozen like this, I would have had to pass up a bunch of opportunities that came my way. But because my body was a lot better and more, you know, not frozen, I was able to get out of bed. I was able to not be on a bunch of muscle relaxers and doped up, like sleepy all the time, and I was able to go and be the best advocate I can as Miss Wheelchair Pennsylvania and help people with disabilities and do what I can. So I definitely thank Kate for changing my life and seeing things differently when it comes to this, and making me able to go and function and not be in chronic pain all the time and worried all the time, like, oh gosh, what's gonna startle me that like causes me to be all, you know, frozen in place then. So thank you, Kate, for all you've done for me. It's been amazing. Is there any final words you'd like to say to anyone?
Just be open-minded. Acupuncture can be so powerful. If you have any worries, anything that's stopping you from getting acupuncture, call your local acupuncturist, anyone you can find. Tell them about your concerns. They'll tell you whether they think they can help you. I've had people call me and I told them, I don't think acupuncture is the right therapy for you. I don't think I can help you. It's not common, but people will tell you that. They'll be honest with you. If you have worries about accessibility, about, you know, whether they can treat you in this position, that position, whether they can work with you. Some practitioners won't do the distal type needling I talked about, where they'll go away from the issues. Call an acupuncturist local to you. Tell them if you have any concerns, and they will tell you whether they think they can help you and work with you. So definitely, most of the patients that come through my door, most of the cases I see are, you're my last resort. I have no other options. Surgery is my only option, or I went through surgery and now the doctors are telling me that I have to live this way. I see that every day. I am used to hearing it, and a lot of times I forget that those patients were like that after a few weeks, after a few treatments, after a few months. Sometimes I'll go back and look at their first chart note and I'll say, wow, I was their last resort, and now they're seemingly fine, and it's shocking. So be open to it. Please don't let the fear of needles, the fear of, you know, it hurting, the fear of it doing any kind of damage, any of those fears stop you, because I've never had an issue with any of my patients, and most people are surprised. So just be open to it, give it a shot. Like Barb said, you really have nothing to lose. Yeah. Except an hour of your time.
Yeah, and maybe a couple bucks.
And a few bucks. So,
yeah, that you're probably going to waste on whatever Western medicine stuff anyways. So,
absolutely.
You know, it just... If you guys have any questions, like when you watch this video, feel free to go ahead and comment down below. I will do my best to answer it. If she's on YouTube, she can always answer it. You know, we are very open to whatever kind of questions you may have that we just couldn't think of. So don't be scared to ask. And again, do your research when you're finding an acupuncturist. And like she said, make sure they're properly educated and ask them about accessibility and all that stuff.
Yeah,
so
look for licensed acupuncturist, LAC. Is what it is. That means they went to a school and took the boards.
That's important.
I just realized that. Yeah, that's super important. So look for that. And then if you call and ask them, say, what was your training like for acupuncture? They'll tell you they went to acupuncture school, they got 3 years, or maybe they tell you they took a course. Then definitely just be cautious with that.
And don't, you know, if they're like, I'm driving an hour to see her. So like, you know, remember, would you drive an hour to see a specialist in Western medicine? If that's the case, it's worth a shot, you know, because if you can only find an LAC that's an hour away, why not try it, you know, like.
And there are certain acupuncturists, if you're in a city or you're in an area, there's not a ton of acupuncturists around here, but
we're in the middle of nowhere.
Yeah, like if you're in New York City or even Pittsburgh or even smaller towns will have more acupuncturists. A lot of acupuncturists will specialize. So they'll specialize in women's issues, fertility, orthopedic, sports acupuncture, you know, neurological issues. So you can even, if you have a lot of options with acupuncturists and you're kind of like, I don't even know where to start, like we said, look at their website, look at their reviews, look at all the different stuff. If they all seem pretty superior, see if they specialize in anything. That means they kind of see a lot of those issues. Personally, I don't specialize because there's just not enough of us around. I don't want to limit the scope of what I do and limit my patient load around here, but that's what a lot of acupuncturists do, and I think that's where the bread and butter of our practice should be ultimately, just like Western medicine. You know, as an acupuncturist, it'd be great to specialize in spinal cord injuries, in neurological issues, migraines, fertility, and that's all you see, and you get really, really good at that one thing. So that's another thing you can do to kind of narrow down the acupuncturists in your areas. Some will specialize, some won't. Doesn't mean they're any less, but if you see someone who specializes in your issue, go to them. Yeah. Absolutely. I would 100% advise it. Asian, not Asian, young, old. If they specialize in that issue, they are the best person you can see in that
with
area.
LAC.
With LAC, absolutely. Absolutely.
Yeah. So I want to thank you guys for tuning into this. It'll probably be a couple videos, like a series. So I want to thank you guys for sticking through. And if you are very interested in this, and like I said, any questions, ask below. And with that said, we're going to sign off here. So again, this is Kate Frame, and it's Frame Acupuncture in Greensburg, Pennsylvania. So if you happen to be local and you are around here in this vicinity, you can always check her out. I will link her information for her business in the description below, so you can go ahead and check it out. Even if you have a website that has information on it too. So even if you're just curious, go ahead and check it out. With that being said though, thank you guys so much, and don't forget to subscribe to my channel. See ya.
Bye.